Good afternoon, everyone, and I want to begin today by extending my deepest condolences to the family and friends of the third Saskatchewan resident who has now lost their life due to COVID-19. Saskatchewan's hearts and thoughts are with you at this time. 2 weeks ago today, I declared a state of emergency to deal with the COVID-19 pandemic in Saskatchewan, and today I am extending that state of emergency for an additional 2 weeks. All of the orders that have been issued to date under the provincial state of emergency will continue, and these measures, I would say, are working. They are working because the people of Saskatchewan, each and every one of you, are doing your part. So once again, I want to say to each and every one of you, thank you. Thank you for doing your part. Thank you to everyone who is still going to work each and every day to provide health care or other essential services in your community and in this province. Thank you to everyone who is staying home to reduce the spread of COVID-19. And thank you to everyone who are finding ways to help others, delivering groceries to someone who is self-isolating or checking in on an elderly friend or a family member or a relative. Thank you to everyone for so quickly adapting to this, what is nothing short of a strange new way of living. Physical distancing, self-isolation, staying away from any kinds of large gatherings, even with our family and friends. None of this is natural for us, well, certainly not natural for us in Saskatchewan. None of this is easy for us, but all of it is worth it. These measures are working. Together, we are reducing the spread and we are collectively flattening the curve. And this will mean ultimately fewer cases of COVID-19. This will mean fewer hospitalizations, and this will mean fewer deaths. We will never know how many lives have been saved by each of us doing these very things. But I promise you that together, collectively, we are saving lives. We still have a long way to go, however. It may be many more weeks. But this is Saskatchewan, and Saskatchewan will meet this moment. In addition to looking after your physical health, we all have to look after our mental health. And that can be especially challenging during such a stressful time as we are experiencing. So today, we want to remind people that all of the resources that are available to you if you need help dealing with mental health issues like anxiety or depression or substance abuse. All Saskatchewan Health Authority mental health inpatient units for adults, children, and youth remain open for admissions as needed and as required. Community mental health sites remain open, offering most of their services via the telephone. Family Service Saskatchewan, in partnership with the Saskatchewan Health Authority, supports 23 mental health walk-in clinics that are now offering their services by telephone in communities across the province. The Healthline 811 number has many dedicated mental health professionals who can provide 24/7 assistance or referrals 24 hours a day, 7 days a week for people with mental health concerns. The Farm Stress Line provides support for farmers and ranchers, and again is available 24 hours per day, 7 days per week. The Kids Help Phone offers professional counseling information and offers referrals by phone, by text, or with online chat. It's confidential, it's free, and again, it's available 24 hours a day, 7 days a week. Our mobile crisis centers are located in communities across Saskatchewan, and as well, they operate 24/7. Our employee and family assistance programs can assist with mental health supports and counseling for government employees and their families. The Ministry of Education continues to offer mental health capacity building supports for staff and students in 5 schools during these closures through online and social media platforms. The Ministry of Social Services staff are supporting clients, they're supporting service providers and approved private service homes, and all of our CBO agencies continue to offer counseling by phone or by way of virtual technology. And Indigenous Services Canada mental health therapists are available by phone or through telehealth to residents of our First Nations communities. In the recently released spending estimates that our government increased funding for mental health and addiction services by $33 million to $435 million this year, an increase of over 8% and the largest investment ever in this area in the province's history. So to everyone in Saskatchewan, if you need to talk to someone during this stressful time, those supports are available for you. And I would encourage you to reach out to your friends and to your family at this time to offer your personal supports. Finally, Dr. Shahab will have more to say about today's new case numbers in just a moment. And while we are deeply saddened by yet another death in our province, the new case number and recovery number in particular show that we are making a difference. But we still have a long road ahead of us. So let's keep going, Saskatchewan. Dr. Shahab.
Thank you, Premier. So just a bit more detail on our epidemiology information to date. So as the Premier said, our new cases at 9 still remain fairly flat in terms of where the curve is. Our total is 193. Number of people hospitalized remains stable in terms of 3 people in inpatient care, 1 in ICU, and these numbers keep going up and down. As Dr. Shaw mentioned, people may go to hospital, may come home while still recovering. People may go to hospital, go to ICU, go back to an acute care floor. So these numbers do go up and down. And unfortunately, 3 deaths, 2 in the 70 to 79 age range, 1 in the 80 to 89. We also need to remember that, as we now enter into a phase of local transmission, not just imported cases, we can report that 87 are in travelers, 41 are within Saskatchewan, mostly through group events, but anywhere from 8 to 12 currently have no known source of exposure, and 57 are under investigation. So we do expect more cases that will be labeled as local transmission without a known source of exposure. And I think that's really important for us to remember that now is not just due to travel. We really need to accept that we have COVID-19 now as a risk in Saskatchewan, and we need to redouble our efforts to protect ourselves, to protect those who are more vulnerable, and really keep the curve as flat as possible. In terms of protecting those most vulnerable, we already discussed all the cautions around visiting long-term care facilities. We also request all communal living facilities like personal care homes and other facilities really to try to prevent large gatherings of residents either in the dining area or where group activities are happening. Maybe try to minimize that, or for socialization have smaller groups, maybe 2 or 4 at a time, having a meal together or having some group activity, really to minimize the risk of a large outbreak in those settings, because as you know, unfortunately from other jurisdictions, those can be particularly devastating in terms of impacting the most vulnerable. So with that, I'll stop and I'll see if colleagues from the Saskatchewan Health Authority had any comments around the mental health supports.
Hi, it's Susan Shaw, Chief Medical Officer with the Saskatchewan Health Authority. I just want to add to Premier Moe's comments that mental health is incredibly important at all times, and particularly in times of stress like many of you and many of us may be experiencing right now. I encourage you all to continue to remain socially connected while physically distant. It's so important to reach out to your family, your friends, your community, your spiritual care groups, or your churches. Your family physicians and your nurse practitioners remain available to you. 811 has 24/7 access to supports, including mental health and wellness supports. And of course, if at any time you find yourself in severe distress, our emergency rooms remain open and are available for you, and we want you to come and see us when you need us.
Thank you, Dr. Shaw. We now have about half an hour for questions. We'll take our first question from the line. Operator.
We have Guy Quinville with CBC.
Hi, is this for Dr. Shahab or anyone from the SHA as well? I'm just wondering, our first 3 deaths are among people who fall within that 65 and over cohort, which overall is a smaller percentage of our overall cases. So I'm wondering if the fact that, our first three deaths, unfortunate though they are among people who were either 70 or above, and the fact that that cohort overall is small, Dr. Shahab, does that give you hope that our mortality rate may ultimately be not as high as perhaps feared?
Unfortunately, these are early days for COVID-19 for us in Saskatchewan. We know that, like the Premier said last time, that it takes up to 2 weeks for you to, when you're exposed, to actually develop symptoms. And once you develop symptoms, we already know that irrespective of your age group, most people actually recover fully within 2 weeks. So that's the good news. Out of 194, 30 have actually fully recovered. So that's an important number to keep an eye on. But we also know that up to 20% based on international studies require in-hospital care. Now, our percentage of in-hospital care is about 3%, and our mortality is less than 2% at this time, like 3 out of 200. But we do know that over time, people who are going to become, who are going to require hospital care, that takes 1 to 2 weeks to develop. So we do expect to see, unfortunately, more hospitalizations and ICU admissions and deaths. While anyone can get COVID-19, we also know from other jurisdictions and other countries that young adults and children may be mildly symptomatic or asymptomatic. Older adults, especially with underlying health conditions and age 65 and older, but especially 70 and older, are more likely to progress to more severe illness. But even there, we have to remember that even in that 80 plus age group, up to 85% actually do recover in the home setting or in the long-term care setting or in the personal care home setting. So I think that's important to remember, that even in the most vulnerable, a large percentage will recover in the home or personal care home setting, but there's a greater percentage that will require hospital care. So from that perspective, again, while it's always very distressing to see hospitalizations and deaths, but the age range of those who are hospitalized is along what other countries have seen.
Do you have a follow-up, Guy?
Yes, thank you. And this is for Dr. Shahab again. It's sort of a continuation of something we've been talking about for a few days. We take your point about not wanting to cite every community where there are cases, because as I understand it, you want people to act like the virus could be anywhere. But on the other hand, the family of one of our fatal victims announced, I think 2 days ago, has said that, they want the government to be more transparent. Specifically, they want the government to list at least every community where the virus has been found in people. So in light of that, those public comments, are you reconsidering your stance on reporting where the virus has been found? If not, reporting the location of each case?
So this is what I'll say based on my professional opinion. And we already knew from returning travelers that even though we were focusing on testing returning travelers, and there was a high degree of awareness in people who had come back, and the test positivity rate in returning travelers was 1 out of every 100 tests. So every 100 people who were returning travelers who got tested because they had symptoms, 1 was positive for COVID-19. Other 99 may have had another viral illness, or may have been too early in their illness to be tested positive. So testing is not 100%, and that's why the recommendation for travelers was stay home for 2 weeks. Don't go shopping. Similarly, now that we are seeing community transmission, we have to remember that up to 30% of people in the community may develop either no symptoms, that's about 10%, or symptoms that are so mild that you may not think twice of going out and about. And that's why physical distancing is so important all the time, even when you're going shopping. That's why there's so many restrictions now on not being able to go to a restaurant, not being able to get your hair cut. Those are exactly the reasons, because even if you feel well enough to get a haircut or go to a setting where you can't maintain the 2-meter distance, there's no guarantee that you or the person providing service is not unknowingly mildly symptomatic and transmitting. So that's why all those restrictions are in place. But having said that, we do want people with significant symptoms, fever, malaise, chills, who have not traveled, to get tested, that allows for their clinical management, especially if the symptoms are getting worse or they have underlying conditions. It also allows for contact tracing. But anyone with any symptoms must stay at home, even if they feel mild enough to not get tested or Healthline recommends they don't get tested. Stay at home for those 14 days till you have recovered. That applies to anyone with any symptoms from now on. And I think that is essential to breaking chains of transmission. And so from that perspective, really, if you take any geographic region with 6 communities, one has a case, 5 don't, does that mean the risk is high in that one community? Absolutely not, because the risk actually is throughout Saskatchewan. And the other thing, of course, is that we have to minimize unnecessary travel, apart from essential services who have to travel from one province to another, from one community to another to provide essential goods and services. We also have to minimize non-essential travel within communities, and of course, minimize mixing within households as well. That is all essential, and the reason why we do that for people who are asymptomatic is precisely because there is no way to predict which community and which household may have a mildly symptomatic case.
We'll take our next question from the line, operator.
We have Ashley Martin with the Leader Post.
Hi. I have a couple of questions. One is about parents sharing custody. What do you recommend parents should do if they're sharing custody of a child or children? Should the child stay in one place and isolate and the parents come in and out of that place? Or should the child be moving from one parent's home to the other like they probably normally would?
Yeah, so that's an excellent question. And so what my recommendation is that if you have obviously a situation where there's shared custody, obviously both parents should minimize physical distancing. Each household should minimize mixing with other households, but as 2 households where custody is shared, as long as no one in any household is symptomatic, the child is free to move back and forth. And that has also come up as a question that while we say that if you have a household, 4 or 5 people, stay to yourselves. If you go out to for a walk, you may be walking closer together as a household, but you should be physically distant from others. But if you have, we have had questions, what if there's only 1 or 2 people in a household, what happens then? You can carefully choose to have 2 or 3 households. They may be friends, they may be partners, there may be other social connections where you can choose to be a virtual household, not more than 10, as small as possible, where you can, but it would be monitored by public health. But beyond that, I think to some extent there is still a need for essential workers to have some capacity to be able to access daycare to some extent. So that is my comments, but Premier, if you wanted to.
I would just add to that there will be certain instances where the operators of individual daycares may choose to not operate during this time. In saying that, we have provided the opportunity for daycares to operate, albeit in a restricted in a restricted fashion, with the number of children that are allowed to be present in any room or in the daycare at any point in time. So under those restrictions that have been enacted on the advice of Dr. Shahab, there are also a number of daycare spaces that we have allocated to be available for those people that are providing essential services in our communities. Our healthcare workers, for example, many of them will require and do require daycare services for their children, as well as people in law enforcement, corrections facilities, the workers that are operating our corrections facilities, as well as people that we often don't think about in our communities that are providing our clean water, water, as well as treating our wastewater that is moving out of our community. So all of these spaces have been opened up, or many of these spaces have been opened up for those individuals. We have an application process online for those families and parents to apply for those particular spots, and then and they will operate under the current restrictions that are in place, and we've provided the opportunity for other daycares as well to operate, but in a restricted fashion.
We'll take our next question from the room. Steph?
Yeah, Premier, what month do you expect these restrictions to remain in place? Obviously, weeks is quite vague. We're hearing that all these restrictions in place seem to be working. So what month do you expect them to remain in place?
I couldn't say as to what month that we would be able to lift restrictions. Things are moving very rapidly, have been moving very rapidly for some time now. So I would be hesitant to say when we are going to be able to lift these restrictions. I would, however, say, and I'm hopeful, that the restrictions that we began to enact about 2 weeks ago are hopefully starting to show results in our numbers. That being said, we may very well have some increases in the days ahead. We just don't know what the future holds. But I would say this, what we are doing is working. It most certainly is working to help lessen the impact, increase the opportunity that we have for our healthcare system to be able to handle what may be coming at it. And for that, I am very hopeful and very thankful for what Saskatchewan residents are doing collectively. And I would just reiterate what has been said by other leaders across this nation in the days gone by, that every week, every day, every hour that we are able to push this into the future, the healthcare impact that whatever it is, to push that impact into the future really buys us some time. It buys us some time to prepare in our healthcare facilities and in our healthcare system. It buys us, quite frankly, some time as well to hopefully work on certifying some treatments for those that are most vulnerable that may be impacted with COVID-19 as well. It buys us time ultimately to be able to develop and manufacture a vaccine for the masses. So every hour, every day, every week is important that we are able to flatten this curve and to push this out into the future. So I'd be hesitant to put a date on it, but I would say that the effort of Saskatchewan people is working today.
Clearly, there has to have been some modeling done behind the scenes from medical experts, public health officials at many levels of government. How long have you been told these measures should be in place for? Obviously, things are fluid, they could change, it could be longer or shorter, but like how long have you been told they should be in place for in order to kind of keep the curve flat?
The modeling that I have seen hasn't, and Dr. Shahab, you may want to add to this, or Scott Livingston, but I'm just going off my memory of the last I looked at any modeling that was, some of that is in the public domain now as well. I wasn't so focused on when ultimately restrictions would be lifted, as that would be, again, a decision that would be at a point in time when we're on the backside of this curve. Hopefully that's sooner rather than later, and hopefully the curve is flatter rather than steeper here in Saskatchewan. So those would be decisions that would be made as we get to those days. What I have seen is, and maybe not even locally in Saskatchewan, but more across the nation, is some modeling that is starting to attempt to ascertain when we may be looking at a peak, if you will. And I don't know if we're quite that far here in the province of Saskatchewan yet as to saying this would be our peak date. I also see some modeling that is coming out with some different scenarios as to how steep that curve will be and what level that peak will be and for how long it will be. So the restrictions, when those come off, those will be decided as we work our way through the days. The modeling that I have seen has not really been looking at when those restrictions would come off, but is more trying to estimate when the peak will be province by province. So for the reason that we know is where to provide the resources, as we are working with other provinces and the federal government on securing our personal protection equipment, for example. We're joint procuring that and trying to ascertain where the peaks are, when those peaks, where they are, when they are, in an effort to ensure that we have the equipment that we need in the right places that we need across the nation. Anything to add to that, Doctor or Scott?
I can maybe add a few things. So at this point, obviously, we are looking very closely to Europe and the US, and so we want to do everything we can to keep the curve as flat as we can on the way up. But obviously, at some point, we want to see the curve going down. Now, is that going to be in 4 weeks, 8 weeks? We really can't predict. But I think the harder we try to prevent it going up, likely the earlier we'll see it plateau and go down, and that is the best case that we want to aim for, but we hope that will happen. It's up to all of us to make sure that happens, but we'll have to assess this on a week-by-week basis.
Is there a comment from Scott Livingston on the line?
I don't have much to add other than what's already been said around the flattening of the curve and the length of time that we're going to be administering these public health orders to help reduce the spread is going to be important in that. But at the end of the day, the SHA, as you know, is planning beyond the flattening of the curve and what that means for providing services to all those folks that are going to be impacted by it. Because as flattening the curve means, is the health system is less likely to be overwhelmed by the number of cases coming in early. But that does not mean it's going to reduce. It may not reduce, in fact, the overall number of cases. It just is going to spread them out over a longer period of time.
There's two numbers that I watch, Steph. One is, the total numbers of positive IDs, but then also keeping an eye on the recovered numbers, which would give you your net numbers that you have at any point in time. And that is a number I watch because that is the number that when you start to put into the statistics of what this is, that helps ascertain what type of a load we are having at any point in time on our healthcare system.
And we'll take our next question from the line, operator.
We have Lisa Schick with CJME.
Hi. Other provinces are seeing a lot of problems in senior care, and the death that was just reported today, this person was over 80. So I'm wondering, was that person in senior care, and can you tell us how many cases and what kind of testing there's been done in senior care homes in Saskatchewan?
Thanks. So the information we have is that all three individuals are not in assisted living or long-term care facility, but we obviously are watching very closely, and any outbreaks or symptoms of concern in those settings are investigated for COVID-19. And so, obviously, it's very challenging with the restrictions that people who have loved ones in those facilities can't visit as frequently as they want to. But, all of that is exactly because we want to minimize any outbreaks in those settings.
Do you have a follow-up, Lisa?
Yeah, can you tell me how many cases and how much testing there's been in senior care homes in Saskatchewan? Like, is there a number, or can you maybe give a ballpark?
I don't have a number, but, flu season is on the downward trend. It's almost finished. But whenever there's a respiratory outbreak in a long-term care facility, and there's several dozen outbreaks that have happened over the last, couple of months, where another organism is not found, testing for COVID-19 is always done. We can try to get more specific information, but I am aware that testing for COVID-19 is done in outbreaks in long-term care facilities, in all inpatients where there's respiratory symptoms and another cause is not found. So that has been happening for several weeks now.
This is I would just add to this. This is an important topic on how we are making efforts to protect those that would be at a higher risk to very complicated outcomes and ultimately bad outcomes with respect to contracting COVID-19. For those, and this addresses maybe Guy's question at the beginning as well, but we moved quite rapidly with respect to restricting the visitors into our long-term care homes, into our personal care homes, assisted living areas, as well as our correctional centers, group homes, very quickly on that. And I'm hopeful that we were moved in an appropriate time there to hold COVID-19 out of those facilities, as the outcomes are just not as positive for our community's elderly and the generation that's went before us. Yesterday and today and continuing in the days ahead, as Minister of Social Services continues his dialogue with ensuring that we are doing what we can to ensure the safety of those residents that are in our shelters and those that also are vulnerable in our communities. And the Minister of Social Services is very engaged personally in that conversation with our shelters and our larger communities here in the province as today wears on, to ensure the processes that we have in place are in fact effectively addressing the concerns of those shelters and those community-based organizations that are providing supports for our communities most vulnerable. We also need to continue to have a conversation, and we are having a conversation with respect to our northern communities and ensuring that we are taking appropriate action, collaborative action with the leaders in Saskatchewan's north to ensure that we are doing what we can to hopefully continue to keep COVID-19 at a very low level and keep it out of our northern and remote communities. So those are some of the areas that we view as potentially vulnerable areas to have a COVID-19 infection, and they're areas that we are very focused on keeping this disease at bay, if you will, keeping it out and keeping it most certainly at very low levels.
We'll take our next question from the line, operator.
We have Kyle Benning with Global.
Hi, can you hear me?
Yes.
So I believe it was in Monday's press conference, the Premier spoke about stricter restrictions coming into place if the situation was to get worse. I was wondering what those restrictions would look like and what it would take for them to come into play.
For additional, I'll let you speak to that if you like, Dr. Shahab.
So at this point, there's public health orders and there's recommendations. And I think we need to be clear about both. So the public health order is no gatherings more than 10. The recommendation is that doesn't mean a house party with 9 people, with 9 different people in your basement every day. And then if there's evidence that that's happening, then, unfortunately, there would be an order to restrict that even lower. But I think, for the most part, I think most of the people I have talked to, they understand this and they are minimizing any non-essential contact. The 10 is the absolute maximum, but many households are not mixing among themselves. They're not having any play dates. They're not socializing. People are very careful even when they decide to visit their parents, for example, or elderly, and keeping that physical distance. And I think that's really important. But having said that, if you have a small family unit of 1 person in the household, you can, as I said before, choose to have 2 or 3 fixed individuals who may be living in different households who become a virtual household of 3 or 4 people. But we really have to minimize this as much as we can, social mixing among ourselves. And that is going to be the key to breaking the chain of transmission.
One of Kyle, the other pieces that I would just take a note, and Dr. Shahab is absolutely correct with respect to the 10-person maximum gathering that we have, but we've also seen Manitoba has taken steps towards very actively discouraging interprovincial travel. We haven't taken those steps as of yet. We're not planning to, but if we did have a reason to, that would be under consideration at that point in time. If we had a known channel of people where there was ultimately a regional outbreak due to interprovincial travel, we would take that under consideration. If we had a regional outbreak in a facility or a community, we would look at that in isolation as to how can we contain that outbreak in that particular area. And we have seen with a couple of large gatherings in this province how quickly people coming together in the 50 or 100 neighborhood can pass this disease off to a large number of people in a very short period of time. We had the Bonspiel in Edmonton, for instance. We had the snowmobile rally just north of Prince Albert, not far from where I reside. So we would look at potentially if we had a regional outbreak in a facility, in a community, in a specific area of a community, as to what action we may have to take in addition to the restrictions that we already have to do what we can to contain that particular regional outbreak into that particular area. We're seeing, for example, Quebec faced with that decision right now in some of their resort communities. So it would be a little challenging for us to predict to say we would do this, we would do this, we would do this. It is to some degree a read and react piece by Dr. Shahab, who is on working many hours each and every day to provide the people of this province with the very best recommendations.
We'll go to our next question on the line, operator.
We have Murray Mandrick with the Leader Post.
Hi, Mr. Premier. The people working in homeless shelters, are feeling that the amount that was dedicated in the announcement yesterday is not nearly enough and spread too thin. They're still frustrated with issues like not being issued N95 masks. What do you say to these people who feel that they are receiving short shrift in what they believe is a pretty critical fight to stopping the spread of COVID-19, given the nature of the community that they're representing, and given the fact that this community is in contact with first responders and others that are very vulnerable?
I would say that the Minister of Social Services, I believe as we speak, is engaging with their shelter and community leaders, and will continue to engage with them to ensure that the processes that we have in place and the supports that we have in place are most certainly there to protect not only those that are working in our shelters, but with the focus to protect those that are looking to enter our shelters. And I think the Minister had spoke yesterday with respect to some of the supports that have been provided to ensure that the proper cleaning and sterilization can be taking place in those shelters, to the supports that are being provided for those individuals that present themselves at a shelter. When that shelter is full, the flow of that individual ultimately into a hotel, and if needed into one of our housing or Sask housing facilities in the province. I would say this to those individuals with respect to not only the PPE equipment, but the supports and the processes that are in place. The Minister of Social Services is working actively as we speak with the shelter operators and community leaders to ensure that we are making the very best decisions to limit, if you will, hopefully stop, but for certain limit the spread of COVID-19, not only across our communities, but into places like our shelters where there are a number of individuals that are most certainly considered vulnerable.
Do you have a follow-up, Marie?
Somewhat related. You're donating your salary increase this year to a good cause and a charity. Other parts of the country have been tossing out the idea that it might be a good thing to reverse the tax benefits that political parties get on that 75%, and in this time make that 75% available this year to charitable donations like food banks, et cetera, that are really under stress right now themselves because of the economic situations and the issues that we just talked about. Is there any thought put to the possibility of doing something like that that might directly benefit and might encourage more donations privately?
No, we haven't given that any consideration as of yet. Although we are actively giving consideration as to how we can provide supports not only to our shelters but to other community-based organizations that are supporting those in need in our communities. And you're exactly right. There's a number of good community-based organizations that I think MLAs on both sides, Cabinet Ministers, caucus members, and I've spoken to Cabinet about what I've done with the salary lift that we have this year. I'll be speaking to caucus later this week, and I would encourage all MLAs, in particular in this time in our province when we are facing in Saskatchewan our own version of a global pandemic in the COVID-19 outbreak, to consider donating at least your increase this particular year. I've chosen the Prince Albert Food Bank as well as the Mobile Crisis Services for that portion of my donation this year. But in addition to that, I'm going to continue to donate to other charitable organizations locally in the community in the region where I live, as well as nationally that do good work and are impactful to myself, my wife, and our family, such as the Red Cross, Ovarian Cancer Canada, and of course Telemiracles. So we haven't considered the former, but I would actively call on and challenge all other MLAs to take the lift that they have this year, put it into our community-based organizations in their respective communities, understanding that we have businesses that normally, businesses and individuals that normally donate graciously to these organizations that just may not be able to do so this spring due to the circumstances that we're experiencing, the economic reality that is happening here in Saskatchewan.
We've got a last question from the floor. Steph?
Yeah, this is to the Saskatchewan Health Authority. Is the SHA rationing what it has for personal protective equipment?
I'm sorry, could you repeat the question? It's unable to hear.
Oh,
I
sorry.
can repeat it here. It was, Steph had asked if the SHA is rationing personal protective equipment.
The answer to that is no, we're not. We're taking a lot of steps to make sure we understand what is the best use of our personal protective equipment, where is it most appropriately stocked, and how do we ensure that we continue to have the right amount of equipment to ensure our staff are safe. The most important thing there is to, again, is to cycle back to the importance of the work of the public to help flatten the curve, and us as healthcare professionals understanding what is the right use of PPE and for what situations, and using it as appropriately as possible.
I also, a similar question, Dr. Shahab, it seems like the number of tests performed seem to be going down kind of in recent days. Can you explain why that is? It almost seems a bit counterintuitive given that there's calls and an expressed need for expanded testing.
Yeah. So, I've been looking at it very closely because this was asked on Monday as well. Actually, the number of testing sites has gone up significantly throughout the province, both in northern communities and throughout the province. There seems to be a lower demand for testing. We have not been able to ascertain exactly why. One of the causes could be there's less people who had traveled who are coming back, who are becoming symptomatic. But at the same time, we are prioritizing testing for people who work in essential services, healthcare, other services that at the first sign of symptoms, they need to be tested so that if they're negative, they continue to work as long as they don't have a fever, just cough. And if positive, obviously, they have to stay home till they're better. We are prioritizing service testing for people who are inpatients, ICU, acute care, long-term care facilities. We are prioritizing testing for northern remote communities. Any case or cluster has to be tested immediately to prevent further outbreaks. So we are trying to promote more testing where appropriate. We are very happy to say that the SHA and the Royal Romanov Provincial Lab, they are fully able to test at current rates and higher rates, but obviously Healthline and primary care physicians and other clinical colleagues have a key role to make sure that we test where it's appropriate. We don't want to just test for the sake of testing. And I'll finish by saying, if you're totally symptom-free, haven't traveled, practice physical distancing, minimize mixing among households. If you have a new cough, nothing else, stay home till your cough is better. Stay home for up to 10 days. You don't necessarily need a test, but stay home. It could be a viral illness. It could be an allergy. It could be, COVID-19. Stay home. It'll go away in a few days, whatever it is. If you're an essential worker just with a new cough, you should get tested so that you can continue to work as long as you're not infectious. And for anyone in Saskatchewan who develops chills, malaise, fever, cough, talk to Healthline, talk to your primary care provider for assessment and if required testing, and testing is widely available throughout the province.
And we'll go to our last question on the line, operator.
We have Colton Weens with CTV.
Yeah, I just wanted to kind of build on that first question that was asked about the locations of the different viruses. And also, we do have a case determined in North Battleford now, and I know it was mentioned that we just assumed that the whole province should be dealing with this and be worried about the virus. But now that we have something in North Battleford, is that not a big enough community that we could say this is happening in this community without risking privacy laws? And will the province ever release more details about the locations of cases?
So you know what, I'll again repeat my rationale for that. If there was a community that had no cases, would that mean that I should not practice social distancing or physical distancing there? Absolutely not. Does that mean that people are free to mix among households there? Absolutely not. I think we cannot rely on test positive numbers by community to dictate our actions. Some of the higher numbers in Regina and Saskatoon are only because of higher populations. If you calculate a rate by regions of Saskatchewan, we have COVID-19 test positive throughout. And I think it would be a fallacy for us to say that, a test result dictates risk. It's just like how in, forest fire season, we have smoke detectors in 5 or 6 sites in the province, and that doesn't mean that's the only place where there's smoke. You can see smoke everywhere. and we have to have the same approach with COVID-19. We cannot rely on which communities may have a case today to dictate our actions or lack of action in that community or another community which doesn't have a case reported as of today. That would be very dangerous, actually, if that changes our behavior.
I would just also say, as Dr. Shahab has said time and time again, that we should be, in our everyday actions, we should be operating under the assumption that the community that we live in does have people in it that have tested positive for COVID-19. We should also act under the assumption that there are people that may not be tested yet that do have COVID-19 in the way that we do not our social distancing, but our physical distancing from one another, in the way that we wash our hands and more often use hand sanitizer, to just be careful about touching our face. These are all things that we can do and we should do each and every day, assuming that COVID-19 is in your community and it is very close to you. In saying that, your question around reporting transparency here in the province, and I had said a few days ago that we will be endeavoring to continue to be as transparent as possible with the reporting that we are providing on behalf of the government to the people of the province, and often through yourselves, the media outlets. I would just ask again to continue to be gracious with us and help us a bit with respect to what, and we will be straight with you as to what we feel we can provide and what we feel we might need a little more time to provide. For example, there are some cases that have been reported in some correctional workers here in the province, and there's some questions around should we be reporting cases in our healthcare employees, for example. I know other provinces are doing that, and we'll endeavor to have those conversations, but we also need to be under the understanding that in the case of a healthcare worker, for example, that it's quite likely that that individual did not contract COVID-ID at work, but contracted, as we saw at a curling bonspiel, for example, or a skidoo rally, or something that they're doing on their personal time. So it's this is a work in progress with respect to being as transparent as we possibly can. We're identifying what other jurisdictions are doing, comparing and contrasting that with what we're doing here in the province, listening to you, the media, with your requests around transparency, and balancing that, if you will, with trying to protect the privacy of Saskatchewan individuals.
And do you have a follow-up, Colton?
No, that should be good. Thank you.
Perfect. That concludes our time for today. Thanks so much for joining us, everyone.